Glaucoma is one of the most common causes of irreversible sight loss in the world. We are in a privileged position to determine those patients that will be at high risk of losing sight from glaucoma through patient stratification. We have an excellent screening service within Oxfordshire and indeed the whole of the UK. My job is to see those patients in the clinic and determine those at the most highest risk of sight loss. Glaucoma is effectively a nerve damage to the optic nerve. It's an optic neuropathy. This nerve is very important because it's the pathway from the outside to the brain. Essentially, light rays from the environment are bent by the cornea and the lens onto the back of the eye called the retina. This information is converted to electrical impulses and sent via the optic nerve to our brain so we can see. In glaucoma, that nerve is damaged, so the pathway from outside the eye to the brain is destroyed, and this is irreversible. The good thing is we can pick up early changes through sequential tests, whether that's scanning of the nerve or functional tests like visual fields to see if progression is occurring. We know that the nerve damage is very proportional to pressure in our eye. Now, that's not to say that glaucoma is pressure alone, because we know there's independent mechanisms like blood supply to the nerve, like hormones to the nerve, that can damage the nerve independently. However, pressure is the only thing clinically that we can treat. Pressure in the eye is proportional to fluid inside the eye. So if we can imagine the eye is a contained structure, fluid is constantly made and it constantly has to leave the eye. Where it leaves the eye is where the brown or blue part of the eye called the iris meets the outer dome called the cornea. It creates an angle. Fluid is created, it travels through the pupil and goes through this angle. So when I explain glaucoma to patients, I like to use the analogy of a sink. So if you can imagine this basin, fluid is being produced, and this fluid from the tap is going through the drain. Now imagine if there's too much fluid being produced and there's a resistance at the level of the drain, where the hair is blocking the drain, that fluid does not go through, it accumulates in the basin. Now in the sink's not a big problem, because what happens, the fluid overflows and dribbles down underneath the basin. Now imagine an eye. An eye is a contained structure. So there's nowhere for that fluid to drain. It builds up in the eye, contributing to raised pressure. So the principles of treatment is you either turn off the tap and produce less fluid, or you manage the drain to increase space for fluid to drain out, or you bypass this blocked drain by creating different avenues. So how do we categorize glaucoma? Well, we can categorize it as secondary glaucoma, whether that's through diabetes or trauma or other conditions, or we can categorize it via this angle mechanisms, to be very simplistic, whether it's open or narrow. Depending on how this is, when we view it through gonioscopy or a contact lens test, will give us an indication of what is the right treatment for you.